session. So we will send out the slides and the recording to anyone who registered tomorrow. And so you can make use of that and share it with your staff and any other interested parties. Want to let you know that there is, if you speak Spanish, there is a Spanish translation line available. You can see your chat. That number is 925-446-8186. You can go ahead and mute us and go ahead and call that line. There is a Spanish speaker there. We're working on a Tagalog translator as well, and I will let you know if we have that update. In the meantime, I'm going to turn over to Dr. Levin, who is one of our deputy health officers here in Contra Costa County and who has immersed herself in long-term care for the last 10 months. And I'm so excited to welcome Dr. Levin here today and hear what she has to say with some exciting information about vaccines, about how it's going to affect facilities. And so Dr. Levin, I turn it over to you.
Thank you, Nicole. Good morning, everybody. Thanks for making the time to join us on this town hall. We wanted to really today just use the time to start having the conversation about why the vaccine is going to allow us to get our lives back to normal and give you some information and education about the vaccine and how it was developed. And really, most importantly, try and answer some of the questions or concerns that you may have as the vaccine starts to become available to you in your workplaces at long-term care facilities. So I'm going to start with just going over some basic information and slides about the vaccine. And then I really want to spend the majority of the hour we have together to address your concerns and questions. Okay, so I have here also the website where you can access the most up-to-date information about vaccines. There's a long list of frequently asked questions at that site, as well as lots of handouts that you may want to share with your staff and links to important information. So why should you get vaccinated? To protect yourself and your family, to keep your residents safe in your facilities, to help stop the spread in our community, and as leaders of these facilities, the facilities that have the most vulnerable, the people that have been most impacted and affected by the COVID-19 virus, you set the example for others, including the residents, families, coworkers, and the community at large. So what are the first two vaccines that we're getting? Pfizer was approved. The Pfizer vaccine was approved 2 weeks ago, a week ago, last Friday, and Moderna got FDA approved this Friday. They're both mRNA vaccines. They do not contain the COVID virus itself. It is the mRNA is what makes a protein that is on the coat of the virus. So they're both using that same technology. And vaccines are the only way we are going to get control of this pandemic. If we want to get our life back to normal and control the spread, everyone has to do their part and get vaccinated to get back to a normal life. The estimates are that it's going to take at least 70% of the community to be vaccinated to create what we call herd immunity, meaning that there's no pathway anymore for the virus to spread in our communities. So what is this mRNA technology? And is it new? It's not that new. We've actually been using it for more than 10 years, and it's been used largely to date in cancer treatments in order to target cancer cells. It's a way of using a protein. The mRNA gives direction to the cells to make a protein that is like the protein that is on the coat of the virus. And that educates our immune systems to be able to recognize the virus when it gets introduced to us. So when we get infected, exposed to the virus, the immune system has already built up a whole army of cells that is able to recognize the virus and stop it in its tracks. So that is how it works. It's sort of like a training camp for our immune systems to be able to defend our bodies against the virus infection. So can the mRNA vaccine give you COVID-19? No, it's not possible. It doesn't have any genetic protein. It is not a live virus. It is not a dead virus. And can the mRNA vaccine change my DNA? No, it does not get into the nucleus of the cell. It just teaches your cells how to make a protein such that your immune system can recognize it. Will you still need to wear a mask? Yes, unfortunately, similar to other vaccines, a large number of people in the community will need to get vaccinated before there's enough drop in transmission that we can stop using masks. Also, although these vaccines are at least in the first 70,000 people that they've been tested in, are 95% effective, nothing is 100%. So we still are going to need to wear masks properly and keep washing our hands. What if I already had COVID-19? Is it safe to get the vaccine? Yes, it is. And we are recommending that regardless if you've had COVID-19, that you still do get the vaccine, because we don't know how long your immunity lasts. Right now, the estimates are 3 months. But that is, there have been cases, although it's rare, there have been cases of reinfection. So we do think that getting vaccinated, regardless of whether you've had COVID-19, will offer you the best protection and immunity. So this slide, I just want to make really clear that there is so much misinformation out there, and social media is full of misinformation and then opinions based on that misinformation. So it's really important that you get your information from reliable sources. And here's just some websites to the CDC information about the vaccines. It's going to just escalate the amount of misinformation that's out there. So I think it's so important that you really figure out what your go-to places are. And besides these websites, the website that I put at the beginning for our local health department, we are going to be constantly updating that. That's going to be a place where you can go to and find these links and others, as well as always a chat box, or you can call our COCO Help call line. So please don't hesitate to reach out to us if we can be a source of information. So when and how long will you be protected by the COVID-19 vaccine? Most of the vaccines to date are 2 doses. The Pfizer vaccine is 3 weeks apart. The Moderna is 4 weeks apart. It does appear that protection occurs in that 1 to 2, the highest protection, meaning that 95% efficacy, occurs in that first 1 to 2 weeks after the second dose. There is proof in the studies, clinical trials that were done, that you do have some protection even starting after that first dose, meaning that when they looked at the people who got the vaccine versus those who got the placebo, after that first dose, there were still more people in the vaccine group that did not get infection, whereas those in the placebo group did get it. So it does start occurring in that after that first dose, but you don't get full protection until you get to 1 to 2 weeks after the second dose.
Dr. Levin, just
Yep.
sorry to interject. We have a request from our Spanish interpreter to sort of slow things down a little bit so they can keep
Sure.
up. I know it's great information. Thank you so much.
Thank you, Nicole. Appreciate that. We most likely will not know how long the vaccine will be protective once we receive it. but we will know more as time passes and we continue to follow people out. So that is information that we will continue to collect as the vaccine rolls out amongst the larger population. It may be that COVID-19 is similar to flu in that each year we have to update the vaccine in order to keep up with the virus changes. And it may be that we end up at a place where this is a vaccine that does occur with some frequency on an annual basis, similar to the flu. So there's a lot of concern about the safety of the vaccines. And this is a really, really important point. Safety is the most important priority in the world of vaccine development and approval. Most side effects will occur within 6 weeks of a vaccination. And to be more cautious, the FDA requires 8 weeks of safety monitoring of COVID-19 vaccines. That being said, they are continuing to follow out those that participated in the clinical trials that led to the approval of the vaccines that we're seeing come out now, the Pfizer and the Moderna. Monitoring for safety will continue as the vaccine is distributed to the public. And to assess, just to give you a sense of the scale at which these vaccines were evaluated, the typical minimum is 3,000 participants to be able to approve a vaccine and prove its safety. These current COVID-19 vaccine trials included 3,000 to 5,000 in each of these studies. So in the Moderna study, it was almost 50,000. I'm sorry, in the Pfizer study, it was almost 50,000 participants that were in the clinical trial. And for the Moderna, it was close to 30,000. So we have over 70,000, between 70 and 80,000 participants in these vaccine trials in which the safety was proven. And that's what led to the approval of these first two vaccines. Should you trust the COVID-19 vaccine? The FDA is using the same strict standards that it has used for decades. No steps were skipped during the development of these vaccines. There were 2 independent advisory committees that reviewed the results before the approval. This included the Vaccine and Related Biological Products Advisory Committee that advises the FDA, and it included the Advisory Committee on Immunization Practices that advises the CDC. In addition, California required, before they approved it, the Western States Scientific Review Board conducted a 3rd independent review of the Pfizer vaccine. So these independent advisory committees that reviewed the results are members and experts of these committees that have no conflict of interest, are not part of the FDA or the CDC, but rather are scientists and researchers in the fields that are well equipped to evaluate the veracity of the scientific rigor that went into these studies. So how was the vaccine developed so quickly? So the major reason is because we're in a worldwide pandemic, and this was a global effort with the world's leading scientists focused on a singular task of how do we get control of this pandemic and get a vaccine out. So there was nearly unlimited resources, money, knowledge, people power, technology, a large pool of diverse adult volunteer trial participants as well. So this was a effort unparalleled to anything we've seen in our lifetimes. Um, and just to also give you a sense, there are many more vaccines in the pipeline right now. I believe it's up to like 13. So we're likely to see more vaccines being developed and released across the world. What is emergency use authorization? It's based on the need to use a vaccine quickly to save lives in a public health emergency. It is a shorter process. The red tape is sort of taken out, but no steps are skipped in terms of the safety evaluation process. So the FDA will assess if the vaccine known and potential benefits outweigh the known and potential risks. And it just sort of speeds up that evaluation review, gets everybody to the table quicker. And like I mentioned before, the 2 advisory boards also will review the data and make recommendations in a more timely and speedy process. It does not, emergency use authorization does not imply that the authorization was done too quickly or that the vaccine is not safe. And again, just want to emphasize that the vaccine trials really included tens of thousands of people. They were a racial and ethnic diversity of the participants in the trials, and a substantial proportion were older adults. So 45% were over the age of 56 to 85 in the Pfizer trial, and 23%, almost a quarter, were older than 65 years old in the Moderna trial. And with those trials, essentially, again, the efficacy was 95% in the Pfizer and 94% in the Moderna. So essentially 95 of 100 who got the vaccine versus those who got the placebo were protected from infection and did not acquire infection with exposure. So what should you expect when you get the vaccine? The vaccine can't give you COVID-19, but what it does is it stimulates your immune system, as I was saying before, to learn about the virus, to recognize the virus. So when you stimulate your immune system to start making those cells to attack the protein, that's how it learns, you may have some short-term discomfort, fatigue, headache, muscle pain, chills, fever, and pain at the injection site. Pain at the injection site was the most common side effect. These reactions usually resolve within a day. In the great majority of people, they can last up to 24 to 48 hours and typically are more pronounced after the second dose, because the second dose, now your immune system has already learned some of it, so it responds a little bit more aggressively. These signs, this is a sign that your immune system is doing its job. It's recognizing that protein and it's exercising itself to recognize when it's faced with the real virus, such that it can attack it and rid your body of it. These side effects are normal, common, and expected. I did mention before that although you get some protection in that first dose, it is really important that you get the second dose, because the vaccine will not fully protect you if you only get one dose. It is also important to get the same vaccine in the second dose as you got in the first dose. All right. So that's the slides I have, and now I'm really happy to take questions.
I'm so sorry. 10 months in, I make mistakes on Zoom still. So we want to thank you for that presentation. I want to encourage everyone to start to write their questions in either the chat or the Q&A, and Dr. Levin's going to answer them. I just want to say again, this is a safe space of facilities specifically. So I want to encourage you to ask any question you have, it needs to be answered today. So Dr. Levin, we're going to sort of start out with, there's a question around actually, if you take the vaccine and you're having some side effects, is it okay to take a Tylenol?
Yeah. Great question. I was actually wondering whether I should say it in that slide. Yes, some people are actually recommending that you preemptively take, so before you get the vaccine or right after you get the vaccine, taking either ibuprofen or Tylenol as a way to reduce your the side effects and the so definitely okay to take it, and either Tylenol or a non-steroidal anti-inflammatory such as ibuprofen, Advil, Aleve, that type of medication, if that's it for you to take.
So if we're an RCFE, and a lot of folks on the call, there are residential care facilities for the elderly. So how can they ensure that they are on the CVS or Walgreens pharmacy partnership list, and that maybe the number that's listed on that is the correct number so that they will actually get the call from them?
That's a great question. The Department of Social Services did enroll all of their facilities into the partnership program. So checking with, and they, if you're a licensee, would have enrolled you with the up-to-date information they have. They constructed it so you're an opt-out. So the only reason they wouldn't be included would be if they contact you and you tell them you're not interested. Mm-hmm. So as long as you can check with your Department of Social Services, your licensor, and verify your information is correct.
Mm-hmm. Excellent. So now, also wondering if should the providers check in with residents' physicians before their residents are vaccinated? You know, if they're in the partnership and they get the call, if they have a condition like asthma or heart issues, should they check in with their residents' physicians before taking the vaccine?
So there is no category of person contraindication based on health conditions. So, and there, you do not require a doctor's order in order to receive the vaccine. These vaccines are licensed only for 16 years and older. So that's the group that, you know, they younger than 16 years of age, which are not your residents, these are not being offered to. But what you do need though is the consent. So you don't need to check in with the physician or a physician's order in order to administer it, but you do need the consent of the person. So it would really be whoever the patient making the decision, the resident making the decision, or if they aren't their own decision maker, the consent of the decision maker for that person.
Excellent. So I think the sort of questions, the momentum is happening of like, hey, when is the pharmacy partnership going to be activated in Contra Costa? When will we start getting that? And a special emphasis on how does that impact our tiny 6-bed board and care facilities? Like, how can they ensure that they are not missed in this rollout?
Great question. This is all moving very fast. And just to let you know, at the county level, we have formed a committee, an advisory committee that's for the ethical and equitable allocation of vaccine, of which Nicole Howell is a member, as well as many other representatives from the community who are giving great thought and developing recommendations on how we distribute these vaccines in an equitable and ethical fashion. The residents of long-term care facilities and board and cares are top of our list in the first phase, priority for getting the vaccines. We do have developed concerns about how quickly the rollout's going to happen with the pharmacy partnership, and are developing a strategy that will allow for our county allocations to be utilized as soon as possible in this first months of the vaccine rollout for these facilities. So our plan right now, so we have heard from some facilities that they are already getting contacted by the CVS and Walgreens in order to set up clinics. My understanding is they are going to set up a total of 3 clinics for each dose of the vaccine at which they will be distributing. But we at the county will also be setting up a system where for the skilled nursing facilities that have the staff to provide their own vaccinations, the personnel to provide vaccinations themselves to their staff and residents, a mechanism that you'll be able to request allocation from us if you feel that you're not getting an allocation from the pharmacies in a timely way. And then for the board and cares and the residential care facilities for the elderly, our plan is to set up a site that will be dedicated to staffs of those facilities, such that the staff can come through and get vaccinated. It will be by appointment is what we're anticipating right now, but that it would be dedicated site of distribution for personnel of these facilities. In addition to that, we are also going to have mobile teams for with a focus on these board and care sites in the community. So we're working out those details. We're probably looking at the first couple of weeks of January when that would really be truly available.
I just think we need to pause and say thank you, Dr. Levin, for not only do we have the pharmacy partnership, but that you at the county are aware that long-term care residents and staff have specific needs, and that you're coming around that to make sure no one is missed. And so I just want to say thank you to you. And I hope everyone heard that not only are we going to have the pharmacy partnership, but the county public health, they are also working to ensure that everyone via sort of clinics, and they're working with you cooperatively to make sure it meets your needs. That's a huge deal. And I'm sure there's more information to come, but that's really great. Thank you so much. So there's a real question here around, how do we handle residents who are on hospice? Those individuals who are working with a hospice agency, what is their eligibility for the vaccine, and how should the facility talk to family members about the issues present?
Yeah. Great question. So we are recommending that regardless of your clinical status, and even if you're on hospice, that you still derive a benefit from the vaccine in terms of prevention of suffering associated with the acquisition of COVID-19 infection. The primary reason that people die from this infection is because it essentially damages the body's ability, the lungs, so much that you feel like you can't breathe, and you're, which is suffering as one of the most uncomfortable and ways to pass. So we are recommending that you talk to families about the part of the vaccine is to prevent an infection that can cause more suffering, and that you want to prevent that.
Mm-hmm. And I would also ask, maybe reach out to the hospice agency proactively to say, can we come around this conversation together with the family and the resident if possible?
Yeah, that's a great idea.
You really did a great job of outlining the first dose and the second dose. And I think for everyone, we're watching the news and we're fearful of that, will there be enough? And so the question is, how do we make sure that they get the second dose in a timely manner?
Yeah, so there is going to be, I think, with each distribution site, whether it's the pharmacy program or, through our distribution clinics and our mobile teams, that will be part of the scheduling, is that when you get your first dose, you're already on the books to get your second dose. So we hope that will roll out smoothly. There is some leeway. You don't have to have it exactly 3 weeks after. They're saying day 17 to 23. There has been questions for the Pfizer one. I'm not sure what the window is going to be for the Moderna one, but that's 4 weeks. So I'm sure there'll be a similar sort of window. The question has been asked, well, what if I don't get it by that 23rd day? Should I still get it? And we're saying, yes, you should still get it. It's just sort of that it's a data-free zone because the trials were so controlled. They made sure everybody got it within that window. That's why they're saying this is what the window is. But our suspicion is that even if you got it later than that window, you would still confer more immunity to you. It's not like your immune system has forgotten that first one. So,
good question. So, we had a question around there. We're talking about Walgreens and CVS as the pharmacy partnership, and there's a question of like, what about Rite Aid? What if my client's a Kaiser member? And so I just wonder if you could speak to the federal partnership that created this mechanism.
Yeah, sure. So as you referred to, it is a federal program. And so it was a large federal contract that was set up with these specific pharmacies and I'm not sure exactly whether it was a bidding process or they needed to prove to and contractually agree that they were going to be able to handle the vaccine, staff the clinics with pharmacists. So that's why those two pharmacies are the only ones that are participating in this. My suspicion, though, is as the year moves, this is specifically to address these skilled nursing facilities and long-term care facilities, this federal pharmacy partnership program. However, we are probably going to see similar to what we've seen with the flu vaccines, is that as the supply chain becomes more replenished and there's more rolling out, that there will start to be availability in these venues like other pharmacies and at your drive-through clinics.
Mm-hmm. So you led us right into our next question. Can someone choose which of the vaccines they get? Pfizer, Moderna, Johnson & Johnson? Do they get to pick?
It probably is all going to be determined by availability. So at these initial months might know in the sense of there's only going to probably be what's available to whichever access point you have. Going forward in the months down the line, there probably will be some ability to decide that you go to one place if you have access to other places, go to one venue over another because they hold a certain vaccine. In terms of the prioritization of the residential care facilities and the SNFs for getting the early vaccine, again, it's going to be limited to these two vaccines until there's approval of more. So,
okay. And I think Debbie, our co-facilitator in this from Choice and Aging, brings up a good question of what about the schemes around vaccines? We're seeing a rise in sort of get vaccinated here or do this. How can our providers be on the lookout for that? And how would they know if it is a scheme and not the real CVS or Walgreens calling them to say, hey, it's time to set up your vaccine clinic?
Yeah, so there have been definitely scams rolling out. There's actually a nice flyer that was done by I believe the Senior Coalition or the Agency on Aging that says what to look out for. So we can certainly get that to you and distribute it. But no one's, you can't pay for the vaccine or buy the vaccine. So anyone offering you to sell it, it's a scam. Anyone asking you for your personal details, your social security numbers. It's a scam. These CVS and Walgreens, again, they will have gotten the information for facilities from the licensing agency. And so that would be the only person you should be expecting to get a call from. But yes, you can't buy the vaccine, and they shouldn't be asking you for any of your personal information.
And it's free.
And it's free. Yes.
All right. Already free. It doesn't need to be paid.
Taxpayers paid for this vaccine. So this is your taxpayer dollars at work that led to the development and the distribution of this vaccine.
Absolutely. So I think it's a big issue, but we've got a couple questions around it of, facilities have home health, home care, hospice agencies in and out of their building. And they're hearing that maybe there might be some reticence either from their staff or from these agencies to get the vaccine. How can they respond to that? And what information is available so they can educate, like you provided to them today, information about that? But then how should they work with that agency going forward if they know those staff members have not been vaccinated?
Yeah, so that's a really great question and concern. And part of why, we're doing this town hall today and planning to do more of them is that there is legitimate concerns and questions about this vaccine. So I guess what I can offer is really using our local website with the informational sheets and frequently asked questions, and making those available to the agencies. We are, as the county, we have a whole team that is working on the communications and the rollout. So please don't hesitate to reach out to us, and we can schedule or suggest to them that maybe it'd be worth it for them to have their own town hall with their agency. I will bring that back as well, and to our larger group, and make sure that we are proactively reaching out to these agencies, that the home health and the hospice agencies, to make sure that they're getting the information they need, because I think that is a really important group. We are not there's not going to be any direct mandate to get the vaccine. We really want people to choose to vaccinate themselves because they know it's the right decision for them. So I would not suggest making any type of restrictions or in terms of people being allowed to provide care or participate in care based on what their vaccination status is. But definitely any way we can help facilitate education and knowledge that allows people to make the decision, which we think is the right decision, to choose to receive the vaccine.
And Dr. Levin, what number can they reach you and your team on if they need to reach out for more information? Is there a number they can access? I think you've got a hotline set up.
Yeah, so there's a COCO help hotline or call center, and that is, let me just look it up for you.
While you do that, I see a couple questions popping up asking around, like, again, were RCFEs in Contra Costa and Alameda auto-enrolled? Yes, RCFEs across the state of California were auto-enrolled in the partnership. And I see some questions around like, hey, but other counties are getting it before us. And I just want to say that has nothing to do with the county or anything, Dr. Levin. That is about the pharmacy partnership, and at the rate that they are reaching out, we are doing as much as we can to push the issue. And yes, you are right. It's also adult residential facilities as well. But the timing, as you know, it's just a little bit off for everyone else based on distribution, location, a whole bunch of logistics that I'm so glad I don't have to manage. But know that it is coming for Contra Costa. And that is why the county is taking these extra measures to ensure that you will get the vaccine. So I hear you, and we hear the frustration. We know you've been through a long haul, but we're doing our best to get it to you.
Thanks, Nicole. So the phone number, and I'll put it in the chat box too, and it's a multilingual call center. So you can call in. They're hooked up with our interpreter services. So please, any language that you need, ask for. It's 844-729-8410. And I'll put in the chat again. It's 844-421. Oh, sorry. That's the testing line. 844-729-8410.
Oh, Debbie beat us to it. There she goes.
Thank you.
Thanks, Debbie. So we're hearing a question of some residents, they're watching the news, they're saying, gosh, I'm on high blood pressure meds or I'm on X medication. How will that affect me?
How will the vaccine affect you?
Yes.
Yeah. So all these participants in the studies, these 70,000 plus participants in the studies, had all kinds of conditions. They weren't excluded on any comorbidities. There wasn't any increased side effects. It is proven to be safe across these populations. So really should not have any impact on your other chronic illnesses, nor on the medications that you take. Like I said, really the way the vaccine and this mRNA vaccine technology is a very specific, targeted method of really just getting your immune system to educated on this specific virus, and it's only that. And like when I talked about how it's been used in past for cancer, I mean, it's been this great revolutionary technology for cancer treatments, because it, as many of you may know, so much of the history of cancer treatment is that trying to separate killing the good cells with the bad cells, because that was all we had were big guns. This is like the scalpel instead of the axe, right? It's being able to really just target on that one virus and that one protein associated with the virus. So shouldn't really have impact on anything else.
Okay, so I was watching CBS News this morning and I heard that there's another mutation of COVID. And so you talked about how specific this vaccine to those protein receptors. If this other sort of mutation comes to the United States, will we be protected by the vaccine that's already been formulated?
Yeah, that's a great question. So what I've heard, probably similar to you, Nicole, is that right now when they're talking about the strain, it's in this sort of new strain, that it may be more infectious, but they do think it still has that same spike protein on the coat. So there is, it's impossible to say for certain, until we have more information. But right now, the thinking is that yes, it will still be protective. That type of mutation that they're talking about isn't. It would take a lot longer for it to mutate to the point where the vaccine would be ineffective. That's what I've heard from the scientists in vaccine development. That being said, a year down the line, 2 years down the line, definitely there probably will be a need similar to the flu to update the vaccine to follow along with any changes that have been made in the mutations of the virus.
Okay. So, again, we have a lot of partner agencies that are in facilities but aren't employed by the facilities. And I saw in the state's tier guidance that they included in-home care in the phasing and outreach. So how can agencies or RCFEs who work with home care agencies or others get information about how home care agencies will be prioritized?
So they are home care and home health agencies, people who deliver care or caregivers in the home, paid and unpaid, are in that next tier of priority in this phase one. So after acute care hospitals and the long-term care facilities, staff and residents, they are in that next tier. So our and those will be they will have access sort of as we get through that first tier. Um, our Again, the team at our county will be are working hard right now trying to set up the plans for how to do many different points of distribution for the vaccine. So there'll be probably options for having for like a given agency, you may be able to schedule a team to come to your site for a day to deliver it, so similar to how the pharmacies are organizing a clinic. Or there might be a point of distribution where where is specific for you to go to and make appointments for. So there'll probably be multiple ways for these agencies to access, but be assured that you will be they will be that priority, that next priority group after we have adequately made sure that the first tier is offered access.
And could they call that 844 line if they wanted updates on where their business is in relation to the current rollout?
They certainly they could. I'm not sure, and they will probably be directed to the vaccine branch. But I would say going to the website, that vaccine tab on the cchealth.org website will probably provide you with the most up-to-date information. If the details aren't there, which they aren't yet, I'm sure of that. When they are available, that will be that's the location where they will be. I think we will be setting up more communications that will come out once we have a more solid plan. So there will be right now, because these the long-term care facilities are our priority. Though your agencies are going to get communications from us prior to the second tier that include the home health agencies.
Okay. So we've got some great questions from the adult residential facilities. And first of all, it's so where did the ARFs fall in around the tiers? So as I understand it, they would be the same as residential care facilities for the elderly, or would there be a distinction?
Yes, that's my understanding, Nicole, is that that we're prioritizing them in the same category as that tier 1 residential care facilities for the elderly. They may not be, the pharmacy partnership may not be prioritizing them. And that, again, is one of the reasons as a county we've decided that we are going to offer an alternative to those pharmacy federal partnership. We want people to take advantage of that, because that is a supply chain where we're going to get more vaccination into our county. But we also recognize that they are not necessarily covering every facility that we consider to be in that same tier. And so want to make sure that we fill those gaps where they exist.
Excellent. And for those folks who are ARF providers, many of their clients are they're clients of the regional center, or they have a fiduciary or LPA. Should they start reaching out to those agencies now to begin to get the consent process to make sure that that organization is providing consent for that individual to get the vaccine?
Yes, I think it's a great time to start doing that, and start having those conversations and hosting. Our hope also was that in hosting this town hall for the facilities, that the facilities would also sort of start doing their own town halls and informational sessions that include things like this. What's the process? How do you get the consent? Start having these conversations with your families and residents and staff in order to prepare and be ready when it's offered.
Absolutely. So, tell us about what will be given to the individual when they have received the vaccine. And then do you have a sense of, will there be something that facilities can display to indicate that they have been fully vaccinated?
Hmm. Um, I'm not sure about what the facilities could display. I haven't seen something like that in the tool. There are these great toolkits right now, sort of that are coming out of. I've seen them in a few places. The CDC has some sort of communication with providers and families. The long-term care medicine website, California Long-Term Care Medicine, has some useful tools and communications. What people will be given, my understanding, when they get the vaccine is you will get some type of card that says you've gotten it on this date. Hopefully there'll be some swag, also a sticker or button, like I voted, I got vaccinated. And it is part of the requirement with this federal pharmacy partnership, and also with all of us who are getting these allocations of vaccine, is a registry. So they have to, document in the immunization registry, the California Immunization Registry, which is the vaccination itself, so that it's accessible. If you went to another system of care for your second dose, or you would be able to see that they had gotten the vaccine, but what first dose they'd gotten. So that is a protected health record, so not accessible to anyone outside of someone caring for that person. So showing up to a site of care and consenting to treatment.
Excellent. So I think this is going to be the last question, unless someone comes in with one other one. And so the question is, after they've had the vaccine clinic and everyone has received the treatment, what if there is a reaction for a resident or for a staff? How should the RCFE proceed?
Yeah, so it depends on what type of reaction we're talking about. Right now, the recommendation is to observe someone for the 15 minutes after administration of the vaccination. And if someone were to have a reaction such as things we call things that would suggest to us an allergic reaction, such as throat swelling, feeling itchy, a rash, then the recommendation is for antihistamines such as Benadryl, or in those rare cases, which I still haven't been able to find actually what numbers there are, although there's rumors of what we call anaphylaxis, meaning a severe allergic reaction, then it would be a 911 call, which is really when someone can't breathe and there's having a massive allergic reaction. That was not, there was, in those 70,000 people, there was reported one anaphylactic reaction that was controlled with minimal, without any ongoing damage. So it sounded like actually a minimal anaphylactic reaction. The recommendation is to not have the vaccine if you're allergic to any of the ingredients in the vaccine. But when I looked at what the ingredients are in the vaccine, it doesn't have eggs. It doesn't have, there aren't the sort of typical, it has some sugar in it, and it has saline, so salt water it's mixed with, but then otherwise it's really just the protein coats.
Well, I'm quite a fan of sugar, so I mean, we can go there. I just want to start by saying thank you to Choice and Aging for being our continued partner in this process, to let you, the facilities, know that we are going to be working to develop some materials to help you work with your staff and residents to understand the vaccine and be distributing that. For those of you who are not aware, we have a webinar this evening for family members so that Dr. Levin, they can hear directly from her about the vaccine, and so that they hopefully won't be calling you as nuts, but will hear directly from physicians in our area. I also want to say this probably won't be our last town hall. We will likely do many more as the situation unfolds. So please be checking your emails, be checking those calls if we reach out to you. But we will hope, Dr. Levin, maybe in the new year after the holiday, we get on here and we do another town hall once we know more.
Yeah, that'd be great.
Excellent.
Definitely.
So I just want to thank all of you, let you know that we'll be sending out the slides and the recording to everyone who registered tomorrow. Please share it with your staff and anyone else who you think it might help. Just want to let you know that we are here for you. We know it's been a hard 10 months. Feel free to call both, again, the numbers that Dr. Levin provided, but also your ombudsman will help you in any way we can. And we are open over the holiday. So thank you so much for everyone's hard work. Thank you, Dr. Levin, for all of your work and this tremendous information you provided, and to Choice in Aging for being a great partner. I wish all of you a happy holidays. If you celebrate Christmas, the Hanukkah, I believe that's over, but wishing everyone a healthy and happy new year, and we will see you soon.
Thank you.
All right, bye-bye.
Bye.